Welcome to the deep dive. Today we're zeroing in on a set of conditions that can really impact our dogs and cats, laryngeal diseases. We've got some detailed medical information here, and our goal is really to pull out the most important insights for you.
Yeah, make it digestible.
Exactly. So you get a clear picture, without getting totally bogged down in the jargon.
Right. And the larynx itself, maybe we should start there. Think of it as a vital piece of plumbing, really.
Okay.
That structure made of cartilage surrounding the remiglottis, which is basically the gap between the vocal cords.
Got it. So more than just the voice box.
Oh, absolutely. It's not just for barking or meowing. It's crucial for controlling airflow when they breathe, and maybe even more importantly, protecting the airway when your pet swallows. Keeps food and water going down the right pipe.
Okay, let's unpack this then. So this key passageway, the larynx, it can be affected by quite a few things.
Yeah, the sources list several main issues.
Right, like paralysis, different kinds of laryngitis. There's acute and obstructive.
Chronic obstructive.
Chronic obstructive, right. Then collapse, which you mentioned we see a lot in those flat-faced breeds.
Yeah, the brachycephalic.
Foreign objects getting stuck, which sounds awful.
It is.
Then the really serious issue of neoplasia tumors.
Yes.
And of course, just straightforward injuries or trauma.
So quite a range. And understanding how these issues actually, show up is key.
How they manifest.
Exactly. Imagine trying to breathe through a really narrow straw. That increased resistance.
Yeah, it takes effort.
It's similar when that laryngeal opening narrows, makes it much harder for air to get in.
Okay.
And that often results in a pretty harsh, high-pitched sound, especially when they breathe in. That's inspiratory stridor.
Right, that distinctive noise. And that restricted airway. It has other effects too, doesn't it? Significant ones.
Definitely. Because they're struggling to get enough air, their blood oxygen levels can drop. That's hypoxemia.
Okay, low oxygen.
Which can then lead to cyanosis, you might notice. A bluish tinge to their gums or tongue.
Which is obviously a sign of respiratory distress.
Absolutely. And interestingly, it messes with their ability to cool down properly, too.
Ah, so heat intolerance.
Yes, and it can even escalate to hyperthermia, overheating.
And what about the voice, if the vocal cords are involved?
Good point. Our sources note that can change their bark or meow, make it sound hoarse, raspy.
Well, they might lose it altogether.
We'll lose it completely, yeah. That's called aphonia.
Wow. Okay, so these effects aren't just localized to the throat, are they? They ripple outwards.
They really do. Connect it to the bigger picture. A poorly functioning larynx can impact the whole body.
Like the respiratory system.
For sure. Big risk of aspiration pneumonia. That's when food or liquid accidentally gets inhaled into the lungs.
Nasty complication.
Very. They can also hypoventilate, not breathing deeply or effectively enough, which just makes the cyanosis worse.
And the heart.
The heart often tries to compensate for that low oxygen by beating faster. That's tachycardia.
Okay. And you mentioned swallowing. Did they go beyond just aspiration?
It can. Our sources link some laryngeal issues, especially if there's an underlying nerve problem called polyneuropathy.
Polyneuropathy affecting multiple nerves.
Right. If that affects both the larynx and the esophagus, the food pipe. Then you might see gastrointestinal signs. Things like retching, regurgitation, even vomiting, and dysphagia, difficulty swallowing.
And you mentioned the brachycephalic breeds earlier.
Yeah, with brachycephalic airway syndrome, BAS, there's often associated esophagitis too. Inflammation of the esophagus.
So it's all interconnected.
Very much so. And what's quite sobering is the potential neurological impact in really severe cases.
Neurological, how so?
If the airway gets seriously blocked and the animal develops severe hyperthermia,
Right, the overheating.
it can actually lead to neurological signs like depression, stupor, or, in the worst cases, even coma.
Gosh, so what starts in the throat can have really widespread, serious consequences.
Absolutely. It underscores why recognizing these signs early is so important.
Okay, let's shift then. Why do some pets get these problems? Or some just more prone?
That's a key question. And the sources strongly suggest, yes, genetics and breed predispositions play a major role.
It's not always simple, I guess.
Not always cut and dried, but there are definite links. For instance, there's a type of laryngeal paralysis in young Bouvier de Flandre
Okay.
that's actually passed down as a dominant genetic trait. Quite specific.
Wow. Okay, a clear genetic link there.
And in Leonberger's, there's a condition where laryngeal paralysis happens alongside that nerve disorder, polyneuropathy.
Right, you mentioned that connection.
Yeah, and the evidence there points towards a possible X-linked inheritance. passed down on the X chromosome.
Interesting. So while maybe not every single laryngeal issue has a known gene tied to it.
Correct. The info says not all are proven genetic in dogs or cats.
But we definitely see patterns in families and breeds.
Exactly. That's well established. We see this complex familial laryngeal paralysis and polyneuropathy cropping up in breeds like Dalmatians, Rottweilers, Leonbergers again, and Pyrenean mountain dogs too.
Right. And then there are breeds more likely to be born with laryngeal paralysis, congenital.
Yes, congenital laryngeal paralysis. That includes the Bouvier again, Huskies and Husky crosses, White German Shepherd.
White German Shepherd specifically.
Apparently so, and possibly Bull Terriers as well.
Okay. What about paralysis that develops later in life?
That's really important too. Idiopathic acquired laryngeal paralysis.
Idiopathic meaning we don't know the cause.
Exactly. Unknown cause. This is pretty common, especially in older, larger breed dogs.
Any specific breeds stand out there?
Labrador and Golden Retrievers seem particularly susceptible to the idiopathic acquired form.
Okay. And we have to mention the brachycephalics again.
Absolutely. Brachycephalic airway syndrome, BAS, is a huge factor for breeds like French and English bulldogs, leading to secondary laryngeal issues.
Got it. Any other specific breed links?
The sources also flag Golden Retrievers as having a higher chance of a specific tumor type, laryngeal rhabdomyoma, and Norwich Terriers seem predisposed to laryngeal collapse or just having a naturally narrower opening.
Wow, quite breed-specific sometimes. Does the age it starts tell us anything?
It can give clues, yeah. Congenital and familial issues often show up early, maybe the first few months.
Though maybe later in some.
A bit later in Leonbergers and White German Shepherds, the sources say. Acquired paralysis, that tends to be older dogs.
And tumors.
Neoplasia is more often middle-aged to older animals.
Okay, so let's talk practicalities. How can you, as a pet owner, spot the signs that something might be wrong with the larynx?
Well, the history you give your vet is incredibly valuable. What have you been noticing?
Right, good kind of things.
Things like excessive panting, maybe struggling more with exercise, or seeming really intolerant of heat. Noisy breathing, that stridor sound we talked about.
That harsh inhale.
Exactly. Any changes in their usual bark or meow, hoarseness.
Yeah.
Even an occasional cough can sometimes be part of the picture.
And in more severe cases, what might owners report then?
Sadly, it can be quite dramatic. Significant difficulty breathing in, collapsing episodes, fainting spells, that syncope.
Syncope, right.
Or tragically, even sudden death in some acute obstructions.
Gosh. And what if there's one of those underlying nerve or muscle issues involved?
Right, like polyneuropathy, polymyopathy, or myasthenia gravis contributing.
You might see other signs too.
You might. Things like regurgitating food or water, general weakness, maybe an uncoordinated or abnormal way of walking.
Although, not always.
Interestingly, yeah. The sources point out that in Norwich Terriers with upper airway issues, those other neurological or muscular signs might not be obvious.
So the signs can be quite varied, maybe even subtle sometimes, depending on the root cause.
Absolutely, which is why the vet's examination is so crucial.
What are they looking for specifically during the physical exam?
Well, obvious things like panting, rapid breathing polypnea, listening for that inspiratory stridor.
Which you said can be less obvious in cats.
Can be, yes. They'll check gum color for any bluish tinge, cyanosis, feel for a high body temperature, hyperthermia.
Okay.
And if they suspect aspiration pneumonia has developed, they'll listen carefully to the lungs for crackling sounds.
And if they suspect those nerve or muscle conditions?
Then the neurological part of the exam is key. Looking for weakness, like in the back legs, paraparesis, or all four legs, tetraparesis, and checking reflexes, which might be reduced.
Are there any really breed-specific signs they might look for?
A couple are mentioned, like a high-stepping walk and decreased reflexes in Leonbergers with that familial nerve issue. And apparently, a higher incidence of cataracts is seen in Rottweilers who have the laryngeal paralysis polyneuropathy complex.
Fascinating details. Okay, let's dive into the why now. The actual causes behind these problems. Laryngeal paralysis first.
Right. For paralysis, the sources break it down. Congenital, born with it.
Why?
It can be due to degeneration of specific nerve cells in the brainstem, like in Bouviers and Huskies. Or sometimes it's congenital but idiopathic. We just don't know the underlying reason yet.
And acquired paralysis, the kind that develops later.
That has a wider range of potential triggers. Polyneuropathies are a big one.
Which can be.
Idiopathic, unknown cause. Familial runs in the family line. Or even immune-mediated, the body's immune system attacking the nerves.
Okay, what else?
Other nerve and muscle conditions like myasthenia gravis or polymyopathy muscle disease.
And that can also be idiopathic, immune, or even infectious.
Correct. And interestingly, sometimes the problem isn't in the larynx itself, but lower down.
How so?
Lesions in the lower neck or upper chest, maybe a tumor or trauma that damage the recurrent laryngeal nerves which control the larynx.
So the nerve gets damaged on its way to the larynx.
Exactly. The sources mention lymphoma, a type of cancer in cats as one example, or complications after thyroid surgery affecting those nerves.
Okay, that makes sense. What about acute laryngitis, just sudden inflammation?
Often, the specific cause remains a mystery, unfortunately.
But possibilities.
Viruses like canine parainfluenza or feline herpes, bacteria like Bordetella, kennel cough, and even stomach acid reflexing up into the throat, gastroesophageal reflex.
Right, and there's a chronic version too.
Yes, idiopathic chronic obstructive laryngitis, long-term inflammation, unknown cause.
In tumors, neoplasia, what kinds do we see?
In dogs, the sources list muscle tumors like rhabdomyoma and rhabdomyosarcoma, various carcinomas, and less commonly things like fatty tumors or plasma cell tumors.
And cats.
In cats, lymphoma and squamous cell carcinoma seem to be the most frequently reported laryngeal cancers.
Okay, then there's trauma.
Right. Could be from swallowing a foreign object that gets stuck or causes injury, trauma to the neck itself, even bite wounds.
Ouch. And finally, laryngeal collapse.
That can be secondary to that brachycephalic airway syndrome we keep mentioning.
Right.
Or sometimes it seems to be a primary malformation or weakness of the structures, like they see specifically in Norwich Terriers.
So quite a complex web of causes. Who is most at risk then? We've talked breeds.
Breed is definitely a key risk factor, as we've discussed.
But are there other things that make severe signs more likely?
Yes. The sources point to things like being overweight or obese extra weight puts more strain on breathing.
Makes sense.
Being in hot, humid environments, especially if the ventilation isn't great.
Yeah, that heat intolerance connection.
Exactly. And having other concurrent respiratory or lung problems can also worsen the situation.
Okay. So when a pet comes in with signs that could be laryngeal,
Yeah.
how does the vet figure it out? What else could it be?
Good question. Differential diagnoses are important. They need to distinguish laryngeal issues from, say, pharyngeal diseases, problems in the back of the throat.
How do they differ?
Pharyngeal issues might also cause gagging or noisy breathing, but difficulty swallowing is often more prominent there.
Okay. Anything else?
Sometimes tracheal diseases, windpipe problems can look similar, but coughing tends to be the main sign with tracheal issues, whereas that inspiratory stridor really points towards the larynx.
Got it. What about routine tests? Blood work, urine tests?
Usually, they aren't specific for laryngeal disease itself.
But they can give clues.
They can, like a high white blood cell count might suggest aspiration pneumonia.
Right.
Slightly elevated liver enzymes could hint at chronic low oxygen. And high cholesterol might pop up if there's underlying hypothyroidism, which can be linked sometimes.
Okay. But if you suspect paralysis due to a nerve or muscle disorder,
Then more specific blood tests become really useful. Maybe a thyroid panel in dogs, tests for certain infectious diseases, and definitely a test for antibodies related to myasthenia gravis.
what about looking inside?
Imaging
Imaging is vital. Chest x-rays are crucial.
to check the lungs.
Yes, check for aspiration pneumonia, other lung issues, or even a mass in the chest cavity, a mediastinal mass that could be pressing on those laryngeal nerves.
Ah, okay.
And if the pet is vomiting or regurgitating, a barium swallow study.
Where they drink contrast liquid.
Exactly.
Yeah.
Along with fluoroscopy, like a moving x-ray, can help spot problems with the esophagus, like reflux inflammation or a hiatal hernia, which sometimes occurs with BAS. Makes sense. What about imaging the larynx directly?
X-rays or ultrasound of the neck area can sometimes identify masses there.
But the main diagnostic tool,
The most direct way, the gold standard for many of these, is laryngoscopy.
using a camera to look.
Precisely. A small camera is used to directly visualize the larynx. It's usually done under general anesthesia or deep sedation.
What does it show?
For laryngeal paralysis, the diagnosis is confirmed by seeing that the arytenoid cartilages, those flaps that open and close the airway, aren't moving properly. Specifically, they fail to abduct or move apart when the animal takes a deep breath.
Is it usually both sides?
Often bilateral, yes, but it can be just one side, especially early on, seen unilaterally in cats sometimes too.
Is there a risk of misdiagnosis with anesthesia?
That's a really important point. Anesthesia itself can sometimes dampen laryngeal function, potentially giving a false positive.
So what do you do?
If there's any doubt, giving a dose of a drug called doxapram intravenously can stimulate breathing.
Makes them take a deeper breath.
Exactly. Which makes the assessment of arytenoid movement much clearer.
Clever. Are there other oscopies involved?
Depending on the signs, yes. If there's vomiting or regurgitation, an esophagoscopy camera down the esophagus might be done to look for reflux damage or a hernia.
Okay.
And if pharyngeal disease or BAS is suspected, sometimes a retrograde rhinoscopy is performed, passing an endoscope backwards through the nose into the pharynx area.
Right. And biopsies. Tissue samples.
Examining tissue samples under a microscope pathology can be really valuable, especially if they suspect chronic inflammation or neoplasia. Samples might be taken during laryngoscopy or surgery.
Okay, so that covers diagnosis. Let's move to treatment. How do you approach these conditions, say, laryngeal paralysis?
It really depends on the severity. If the pet is stable, maybe just showing mild signs and waiting for surgery, they might be managed as an outpatient initially.
But if they're in distress?
If they're in severe respiratory distress, it's an emergency. Immediate stabilization is critical.
What does that involve?
Things like sedation to reduce anxiety and effort, maybe giving a fast-acting steroid like prednisolone to decrease swelling, and active cooling measures, 5E fluids, fans, cool water, or alcohol application if they're hyperthermic.
And nursing care afterwards or while waiting for surgery?
Crucial. You absolutely need to avoid warm, stuffy environments. Minimize stress and excitement.
No neck collars, I assume.
Definitely no cervical collars. And preventing weight gain is important, or encouraging weight loss if they're overweight. That can make a huge difference.
And activity.
Significantly restricted, especially in hot weather. No strenuous exercise.
Client education must be massive here.
Huge. Owners need to understand why surgery is often recommended for paralysis, the risks of not doing it.
Like
Ongoing low oxygen, risk of heat stroke, aspiration pneumonia, potentially even suffocation. It can be life-threatening.
But surgery has risks too.
It does. Potential complications need to be discussed. And if there's underlying polyneuropathy, the overall prognosis might be more guarded, even with surgery.
And the possibility of it being inherited.
Yes, that needs to be discussed in relevant breeds. For tumors, obviously, explaining the surgical options, potential for chemo, and the prognosis is key.
Okay, so surgery for paralysis, what's the usual procedure?
Unilateral arytenoid lateralization is generally the preferred surgery in both dogs and cats. It's often called a tieback.
Tying one side open?
Yes. Surgically securing one of the arytenoid cartilages in an open position to permanently widen the airway.
Why only one side?
Doing both sides significantly increases the risk of aspiration pneumonia postoperatively because the airway can't protect itself as well during swallowing.
Okay. Do they do anything before surgery?
Sometimes oral prednisolone is given for a few days beforehand to reduce laryngeal inflammation and swelling.
And surgery for tumors?
It can sometimes be curative, especially for certain benign types if completely removed. If removal isn't possible or complete, a permanent tracheostomy,
creating an opening in the windpipe.
Yes, might be done as a palliative measure to ensure they can breathe.
What if surgery for paralysis isn't an option for some reason?
Medical management, usually with oral prednisolone long-term, might be tried to reduce inflammation and signs, but it doesn't fix the underlying problem.
And for lymphoma?
Chemotherapy is the mainstay, especially in cats.
After surgery, what's the monitoring like?
Close monitoring is essential. Checking temperature frequently, watching closely for any signs of coughing or difficulty breathing that might indicate aspiration pneumonia.
What improvements should you see?
If successful, you should see a noticeable improvement pretty quickly. Better exercise tolerance, much less noisy breathing, better heat tolerance.
Does the paralysis ever come back after surgery?
Recurrence of signs is rare if the tieback surgery is done correctly, but aspiration pneumonia remains a lifelong potential risk.
Because the larynx is fixed open on one side.
Exactly. The risk is higher if bilateral surgery was attempted or if the pet had pre-existing swallowing issues.
And complications from tumor surgery.
Risk of recurrence if the tumor wasn't completely removed. And again, potential for post-op aspiration pneumonia.
Okay. Lastly, what's the expected course? The prognosis.
For the common idiopathic laryngeal paralysis treated with tieback surgery, the outlook is generally good. Quality of life often improves dramatically.
But without surgery.
Guarded to poor, really. The risks we mentioned, distress, heat stroke, aspiration, remain high.
What if they have paralysis and esophageal problems?
That combination generally carries a poor prognosis, unfortunately. The swallowing dysfunction complicates things significantly.
And for tumors?
It varies hugely. Benign tumors, if fully removed, can have a guarded to good prognosis. Malignant ones, like carcinomas, generally have a poor prognosis, even with additional therapies like radiation.
And feline lymphoma?
A variable. Depends on the specific type of lymphoma and how well the cat responds to chemotherapy. Some do quite well for a time.
Right. So bringing this all together, our deep dive really shows that laryngeal diseases are, well, pretty varied, aren't they?
Definitely. A diverse group of conditions. And we've seen how genetics, breed, even environment can play a role.
And the key takeaway seems to be spotting signs early and getting proper veterinary care are absolutely crucial.
Couldn't agree more. Effective management hinges on timely intervention. It really can improve the quality and length of life for these pets.
And hopefully this information helps you, the listener, be a more informed owner or just someone interested in animal health.
Yeah, being aware, especially of breed risks, lets you be more observant. Knowledge empowers you to seek help when it's needed.
Absolutely. And on that note, maybe a final thought for you to ponder. Given the range of causes we've discussed and that clear genetic link in some cases, what role does responsible breeding really play? Could it help mitigate how often we see some of these tough conditions, particularly in those predisposed breeds?
That's a really important question. Definitely food for thought about future prevention.
Indeed. Thanks for joining us for this deep dive.